Targeted therapy. We now have tests, Dr. Bob, that once we do surgery or do a biopsy and we remove tissue, we can actually send those breast cancer cells for a laboratory test that tests your own breast cancer cells, DNA and RNA, against a panel of other patients who have been through this journey before. And we know how those people were treated, and we know how their results turned out. So we can analyze your specific tumor against those specific panels, and we can predict if we treat you one way, how you might respond versus another way, how you might respond. And what it's really allowed us to do is to avoid giving unnecessary treatment. Back to what I was saying earlier about throwing the kitchen sink at it. Now we know a lot of times we don't need to. We can back off and give very specific therapy that works only against those targets, those HER2 receptors or other things that we didn't have 10 years ago. Yeah. So we can be very focused to try to minimize the side effects of the treatment.
John, I think that's why it's so important that people understand that the money that they're giving for research is being very productive. Here we've got individualized treatment. Every breast cancer is different. Everyone is treated different. Everyone has the knowledge of knowing what they can do. Now, before we get into the surgery, let's talk about BRCA1, breast cancer 1 and 2 genes.
Breast cancer susceptibility genes 1 and 2, so-called BRCA1, BRCA2. These were identified in the late 90s. Now there's a whole panel of them. There's like 18 different genes that we know now, the so-called Ambry panel and others. And what we know, again, through a simple blood test or a swab of your DNA, an oral swab, we can send that off and we can ask the question, do I have a gene that predisposes me to breast cancer or to ovary cancer?
And that's a key issue too.
Absolutely, because as I like to say, there ain't no mammogram for ovary cancer.
So this is a way we can sort of have a hint or suspicion or knowing that we need to look for that if they've got one of these BRCA1, BRCA2 genes.
That's right. And depending upon which mutation and depending upon your family history, we can put that into a mathematical model. Amazing enough, Dr. Bob, and we can come up and tell people, this is your likelihood of developing breast cancer and or ovary cancer by a specific age, and people can then use that to make decisions about how they want to be treated.